Okay, we're going to go ahead and get started, everybody. Good afternoon. My name is Victoria Lancey from Michigan Center for Rural Health, and I'm going to be facilitating this program. And I would like to welcome to everybody to today's special topics grand round on Lead 101, the role of public health and primary care provider in children in elevated blood levels. This program is provided by the Michigan Center for Rural Health in cooperation with MSU College of Nursing and the Michigan Department of Michigan Department of Health and Human Services, and the Child Lead Poisoning Prevention Program. Before we begin, just a couple reminders. If you're logged into the webinar portion via the link provided and have computer speakers, you can listen to the audio through them. If you are listening to the program through the audio number provided, handouts are located on our website for you to follow along. Our website is www.mcrh.msu.edu. Click on the Education button across the top, scroll down, find today's date, and then there you will find the handouts. Also, I'll be emailing them out to you in a little bit just because I know I posted them at the last minute. Continuing education is available for nurses and social workers, and then we can also provide a certificate of participation for all other health professionals that participated. Please note that there is a new process for nurses and social workers. There is no attendance form, so when you registered, that was your attendance form. If you listened to the webinar today as a group, please send me a list of everyone that participated in your location with their first and last name and email so I get them the evaluation link. Evaluations will be emailed directly to everyone who participated in this program, and you will have 2 weeks to complete the evaluation, or it must be completed by October 3rd. If you would like to ask a question, please type it into the chat box, and I will make sure that the presenter addresses it during the Q&A component at the end of the presentation. Or you can ask it verbally during at the Q&A component and when I unmute lines. Our speaker today indicates no conflict of interest, and the planning committee did not have any conflicts. With that, there is no commercial support for this program, and I'm pleased to introduce our speaker, Karen Lishinsky, who is a nurse consultant at the Michigan Department of Health and Human Services Child Lead Poisoning Prevention Program. With that, take it away, Karen.
Well, hi, everyone. Good afternoon. I guess it is after 12 o'clock, and so happy that you could join us. I just wanted to let you know that we've been anxious to present this material to the providers, and I see there's actually some nurses and some of my lead nurses and some familiar names and faces. I don't see faces, all of the faces, but I see the names. So thanks for joining us. And I hope you don't get tired of all my presentations, since a lot of you have already we just had a statewide training for the nurses, so they're duplicating it a little bit. It is a little bit different, so hang in there. So today we're going to talk about the common sources of lead exposure, how to identify the children at risk for the elevated blood lead levels. We're going to talk about the negative effects of lead exposure, our guidelines for providers, and I want to make sure everybody has had a copy of our provider guidelines, and if not, I'm going to email them to you, and we'll talk about our new educational handouts as well that I want to get to everyone probably by next week they'll be all printed and done. And then we'll also talk about the roles of the local health department and the Lead Safe Home program, which is our sister program that works with the remediation and funding that abatement for the lead-based home hazards in the home. And then we've got a few slides about Michigan data and where we're at with that. And I welcome any questions and be happy to try to answer them. And if I can't, I'll certainly get you somebody that can help you with that. So I'm hoping by the end of the PowerPoint, or I think they're calling this a webinar, we are going to be able to identify the common and uncommon sources of lead. And we'll all know what the blood lead testing requirements are in Michigan. We'll have an idea of how this toxin affects children, and we can talk about what the role of the provider is in the elevated blood lead cases. And again, we're going to talk about, we'll be able to know what CLIP does, the local health departments, and the Lead Safe Home programs, lots of abbreviations I know, and we'll talk about that later, in the elevated blood lead cases. And I've got, I'm hoping this will provide you with the necessary resources. So when you have a client with an elevated blood lead level, you'll know how to appropriately refer these resources to the families. So let's get started. We get our guidance from the CDC, as you probably know. And according to the CDC, there is no safe known level of lead in a child's body. So to say a certain level is okay, that's not true. They consider any level an unsafe level in a child's body. They describe low-level exposure as between 5 and 9 micrograms per deciliter. That is considered the new reference level as of 2012. Prior to that, it was 10, and back in the early 90s, we were 25. Back in the 60s, it was 40. So lots of us baby boomers, if we had a blood lead level in the 40s, we would have been considered very normal at that time. So we've learned a lot about the lead exposure and the effects of on children. So gradually, as more studies became known, the CDC has recommended the lowering of the reference value. It used to be called the level of concern, but they've taken that nomenclature out just because they feel that indicates that there is a level that's not concernable, and they don't want to say that. So they say any level is a concern, but this is the reference level. As of 5, they use the 97.5 percentage of children in the U.S. Under the age of 6 have a blood lead level under 5 micrograms per deciliter, and so they consider 5 as elevated, meaning 2.5% of all children in the U.S. Under age 6 have that level of blood in their blood. So really, again, we want to be proactive, and we don't want any child to be exposed to any lead. But that 5 does trigger some action in our state. Other states have different levels where they'll provide action. So we're going to talk about at what level and what happens at certain levels as we go through the PowerPoint. So as many of you know, and many have been involved in lead, there's lots of moving pieces, and it does take a village to provide the care and treatment for children that have been exposed to lead. We are talking with our primary care providers, the families, of course. Here at the state of Michigan, the Childhood Lead Poisoning Prevention Program. I mentioned the Lead Safe Home program in our Healthy Home section. Of course, our local health departments are boots on the ground, and they do actually, interact with the families directly. We also interact and partner with Children's Hospital of Michigan, that's located in downtown Detroit. And they actually do most of the chelation cases in the state of Michigan. They are the most experienced, and they do this on a regular basis. And I realized, and I was happy to hear that somebody from the UP Health Plan, we did welcome some of the staff from there last year when we did a training up in Marquette. So I'm not sure if you're the same person, but welcome. We do work closely with the Medicaid health plans. WIC, of course, again, another partner. WIC requires children to have a lead test to be enrolled in WIC. And just recently, the Lead Commission, recently appointed by the governor, has made possible made it possible to provide some WIC agencies all over the state with some lead care machines so they can start testing in the WIC clinic itself. As many do not due to staffing or other budgetary constraints, but we're hoping with the lead care machines being available to these agencies that they'll be able to start testing, and we will be getting those testing rates up. And in small, but some cases, we do work hand in hand with Child Protective Services. That's always the last chance or the last resort, but sometimes that is necessary to get a child treatment when the parents are reluctant to have that happen. So why are we so worried about the children? Well, because of their size, they absorb 50% more lead than adults. And again, this is a crucial time when the neurological system is developing. Yeah. And this. No, not yet. Oh, I'm sorry. Somebody was asking a question. So sorry. The neurological systems develop during those first 6 years of life, and this is when the most damage can occur during that development. Children have that behavior that makes them very vulnerable to picking up lead dust and ingesting it because they play on the floor. They play right at the windowsill. Seems to be a very popular area for toddlers. It's right at their eye level. And they have lots of hand-to-mouth activities. That's all they want to do is put things in their mouth. So when they drop that pacifier or toy on the ground, if there's lead dust, they pick it up and put it in their mouth. We find that that's a very, very common way that a child will have an elevated blood lead level. So how are they lead poisoned? Again, like I just described, that ingestion. And it's mostly 90% of our cases are from lead paint. With aging housing stock in all areas of the state, chipping and peeling paint is easily ingested. From what I understand, paint chips are sweet tasting. So when a child sees a colorful piece of paint chip and it's a lead-based paint chip, that can cause quite a problem if they ingest that. Many of our chelation cases, when they get to the hospital, the first thing they do is an abdominal x-ray, and they find that belly is full of paint chips. Lead dust is a problem as well, and that's even more, it's just mainly more of a problem because it's pretty much invisible. You can't even see it, and it'll just come down and be on your floor because of the friction of windows, doors. They produce this microscopic dust, and it all settles on the floor, which is why we provide families with education about cleaning, wet mopping on a regular basis. Window troughs and painted porches are problem areas as well. But that lead dust and the small particulates are very easily ingested and inhaled. Again, we have a lot of issues, especially with the new, and I find myself watching them all the time too, the new HGTV shows. Everybody wants to remodel their home, knock out walls, favorite activity there. And so when you do that and disturb that paint, and it's a home built before 1978, many times that wall is full of lead paint, and with that dust, it just creates a very big lead hazard. And if you remain in the home, a child can easily be poisoned that way. I've had families call and ask, and as it turns out, that's how their child has had an elevated lead level. And of course, like I mentioned, that hand-to-mouth behavior, it's just a perfect storm. A toddler, their brain is forming, and at the same time, they're putting everything in their mouth. So it's just a battle that we constantly see. So we talked about paint, which again, this is the main source of exposure to lead. But we also have soil. Many years of leaded gas have left soil full of lead in many cases in many areas. If you see off ramps or a freeway, and the sides of the freeway are full of, they're probably planted with sod or some trees, but underneath that soil is probably very contaminated with lead. It's, again, because of the years and years of leaded gas, which was not phased out to the early 90s. We do see the imported products as well. We see candy from Mexico. We see glazed pottery dishes from Mexico. They're beautifully done, but in many cases they're not fired like we do. They don't have the glaze that we do. And if they're used for cooking or drinking, that glaze can wear off, and then that lead paint leaches through. They use lead paint because it's so bright, it keeps that paint bright, and it's very durable. So it's popular to use in many ways, I guess, with the colors and to make it look pretty, I guess. And the other imported products, like I kind of alluded to, was we are seeing things from Mexico, again, like I said, India and other, Iraq, other places that many people have immigrated from, and have family left back at home, and they are sending these products to their family here in the United States. We have found 2 children recently in the Detroit area suburbs that's exactly what happened. Grandma from India sent the supplements that they had always used to the baby. At 6 months old, they start giving this. And we wondered why that child had to be chelated. The level was so high. We had that substance tested, and it's called Bugatti. And we ended up having to, put an FDA health alert out about it. It was almost all lead, and they were giving this on a daily basis to a 6-month-old. So these are the kind of things that we want to make sure that you're aware of. Again, the cultural practices, using things in the hair, Sindor, and other things, it's usually very brightly colored, and many times contains high levels of lead. The other things we do see adults with high lead levels, and that's mainly occupational exposure. And what we see, we see it, in the weirdest places. We had a child in the UP. We could not understand where she was being exposed. Turned out Dad was a welder on the Mackinac Bridge, and he was bringing home lead. He was being exposed to that and bringing it home on his clothes. So we asked, we give that education to the families. If you work in an automotive area, a welding area, there's many other occupations, firing ranges that expose their workers to lead. And we ask that if that is true, that they either change at work or leave all their clothes outside and not bring that in the home. First things the kids do when Dad gets home, they jump on him and give him a big hug. Excuse me. And we find that that is a very common way for these children to be exposed, just from bringing it home on their bodies. If an adult has that occupation that he's being exposed to lead. There are other hobbies that people do work with lead, making stained glass, making pottery. I know a number of men make their own bullets. And we have had a case where a child had to be chelated. Their level was so high because Dad was making his own bullets on the back deck, and it was wafting into the home and causing that lead hazard for the children. So we should be able to tell which children have elevated blood lead levels, shouldn't we? Like many of our other things, we can tell by the symptoms, but unfortunately, they don't. What we say, lead exposure, lead poisoning would get a lot more attention if children had these big red bumps all over them when they had a high lead level, but they don't, and they're very vague, the symptoms, and they also could be other illnesses, stomach aches, hyperactivity, not eating, sleeping difficulties. Sounds like your normal toddler, right? But most children, even at high levels, they do not have symptoms. So we cannot go by symptoms alone in determining if a child has a high blood lead level. Here's a slide that we like to use, especially for the providers and the scientists. The metabolism of lead, and again, it's mostly GI and absorption. And the absorption is similar to the iron and calcium, which is why we encourage families to, have that good diet, and we provide, WIC does provide dietitian referrals, because if the body is not getting enough iron or calcium and the lead is available, it will absorb that as well. So we want to make sure these children are getting enough iron and calcium to keep absorption way down if they are exposed. And then that depends on the age and the size of the child and the type of exposure. Chronic is considered a little more dangerous if a child is chronically exposed to lead dust for over the years while he lives in a home with deteriorating paint. That is considered more dangerous than the acute incident. Let's say a child would go to grandma's house, picks up a paint chip and swallows it and ends up with a sky-high blood lead level. And that's kind of a one-time incident and not considered as dangerous as the chronic exposure. Still, we don't want either one, of course. And you can see by the x-ray, this is a child that's 3 years old and 2 months. And you can see, especially on that femur, how delineated that is, and you can see where that goes. Blood half-life is about a month. I know there's been things in the news that says blood lead levels go away in a month. Well, that's not true. It's a half-life is a month. I'm still working with children years and years after they were first exposed, and they ended up with maybe a level in the 30s or 40s, and I'm still working with them. So it just doesn't go away in a month like I think some of the news outlets would like you to believe. And again, it is stored in the bone of children, more than half of it. And again, that can be released at different times and different stressors, and which is why we're starting to look at testing pregnant women. Again, pregnancy is a stressor on the body, and if a woman had been exposed as a child, she may be releasing lead into the blood upon that stressor of pregnancy. So some of the health effects, I'm sure many of you know, but just to go over them. So we got damage, it can damage the kidneys, ears, eyes. Again, it is a neurotoxin, so we're mostly interested in the brain. It's not reversible. We can mitigate damages by many intervention, but again, if there is damage to the brain, there's no coming back from that. Children can have a lower IQ and have problems in school learning and with reading and writing. Again, the neurosystem is the one that we're mostly concerned about. It can lead to violence, aggressive behavior, learning disorders, ADHD symptoms. And again, studies have shown, there's many studies out there, and this has been proven that reduction in IQ by as many as 5 to 8 points at the lower levels. The levels that we thought were fine before are now showing this chronic lower level can be, again, more dangerous to a child than an acute high lead level. Many children exhibit, bad behavior. We see the higher juvenile delinquency. There was a study that they call the Cincinnati study, if you want to reference that. They studied children in utero until their mid-20s, and they tracked the number of times they were, with children with high lead levels, were incarcerated, and it definitely has a link to that. So that potential link to criminal behavior and dropping out of school, they have trouble reading, they have trouble learning, and they just get frustrated and tend to drop out. So these are all things that can happen without intervention and due to lead exposure. This is just a slide about vision loss. Again, lead affects the sensory receptors, and it is a rod toxicant. and it can cause degeneration in children and adults as they get older. We're just now seeing studies about effects of lead as adults go, get older in their 40s and 50s and 60s. They're starting to show some linkage to heart problems, kidney problems. So again, another reason not to let that happen in the first place. Hearing loss, lead is, the auditory system is extremely sensitive to lead. And certainly a hearing test is indicated if you're concerned about a child, and if you feel like a child has been exposed and has a high level, a hearing level or her hearing test is definitely indicated in many cases. And again, the early brain development, those synapse connections, they peak at age 2. They start the pruning process, but with that lead, that neurotoxin, that starts to interfere with this process. So we don't want any pruning that it's not necessary. We want to keep all our synapses as we can. So in the body cells, again, this is just a little kind of a review. The lead competes with calcium. So we want to make sure that child has his calcium, enough calcium, so that lead doesn't take over. It also interferes with the red blood cell production, and it's more easily absorbed from the empty stomach. We provide a lot of nutrition counseling in the WIC agencies, and then our nurse case managers have a module that they interact with the family with and make sure that they are well aware of the diet that the child should have once he's been exposed to lead. And then again, if the iron is deficient, lead will just take over. I don't have enough. Our body's saying I'm not getting the iron, so I'm just gonna pick up this lead. It doesn't know the difference. So we see that the study from University of Michigan has shown that connection between the criminal behavior and the reduced productivity. And they estimate that for every 1 microgram per deciliter raise in blood lead level, the estimated cost is $1,100 per annual income per child. So as a society, we incur those special education costs and the increased costs to the welfare system, the educational, again with the special education, and the criminal justice system. A TED Talk that I really like to refer to is TED. It's a principal in Rochester, New York, and when he did some research into a special ed education students, he found that 100% of them had been exposed to lead and had higher than normal lead levels. So he was astonished. So for diagnosing that, we can do the venous or the capillary blood lead testing. Many offices do the capillary testing and they use the lead care machine to give that instant analysis. We really like that. I know it's very convenient for the offices. They can talk to the patients and the families right then and there because they have that instant result. But we recommend that if that capillary is higher than 5 micrograms per deciliter, that a venous confirmation be done. That venous blood test is the gold standard. That capillary test can be a little bit, it's not as accurate sometimes. Just sometimes do the technique. If you're not cleaning the hand as well as you should, sometimes you can get that elevated level and find out later that it's a less than 1 venous and it's a high level capillary. So we like to confirm those tests with a venous blood test. So there really is no treatment medically for children that have been exposed to lead. The only treatment there is really are children with very high blood lead levels at 45 or above, and that's called chelation. Treatment, we say now, is the source identification and removing the source. And the public health nursing and the environmental investigations, they intervene at the levels at 5 and above, and that's at a venous level. So just to talk about chelation for a minute, they consider chelation at 40 in some cases, but mainly always at 45. Over 70, they're considered extremely an extreme emergency and recommend that child be admitted ASAP to the emergency department. We recommend inpatient chelation. So does the AAP, and the Children's Hospital of Michigan in Detroit do the inpatient chelation for many reasons: the compliance issue, the monitoring, the kidney function, vital signs monitor, everything. That child will be there for 4 or 5 days and be monitored 24/7. Sometimes there is an oral chelation option, but as Dr. Bombani, who is our mentor and our go-to person, she runs the lead clinic and has for the last 30-some years. She feels that the compliance issue is a big problem, and a child cannot go back home to that home that has all the lead hazards while being chelated. They're especially vulnerable at that time, so they want to make sure he's in a safe place. So the hospital is the place. Just to show you that chelation happens all over. This summer we had one up in the UP in Alger County, which was unusual. But you can see that it happens quite a bit all over. There's also a child this summer, again, in Ingham County. It's not colored in, but because that child was over the age of 6. And these are just under 6 is what most of the data that we have shows. But I just wanted to show that it's one more county involved. And of course, you see the epicenter of the chelation cases. That's shows Wayne County, that part of Wayne County, that is the city of Detroit. And they do have the biggest problem with the chelation cases. But again, it's spread around. Now, who's at risk? Anybody can be poisoned, but children between 6 months and 6 years are most at risk, and we talked about that because of their developing body and their hand-to-mouth behavior. And again, we worry about the pregnant women and children that come from foreign countries that are adopted. They don't test for lead in many countries, and several countries are still using leaded gas. Refugee children are at risk as well as the migrant children. And who should we test? All children insured by Medicaid are required to be tested at ages 1 and 2. And if they're not, if they enter onto Medicaid between 3 and 6, they need to be tested one time as well, if they weren't previously tested. WIC requires their children to be tested. Children enrolled in Early Head Start and Head Start also require their children to be tested. And we recommend that all children and pregnant women considered at risk be tested as well. So how do we know that? Well, here we go. Here's the questionnaire that we recommend that if a child is not in any of those other categories or in any of those other programs, that these questions be asked. These children and adults and pregnant women live in a home built before 50. And you wonder why we've listed that twice. Well, the children or the paint in 1950 had much higher lead percentage than the paint in 1978. After 1950, they started lowering that percentage, but it still did have a significant amount. But we worry more about homes that were built before 1950. And again, if children, if they have a sibling with an elevated lead level, we want to make sure that child is tested as well. Again, with the adults, the occupation, home remedies that we talked about, and in that special population. So if the answer is yes to any of these questions, we ask that you please test. Here's our quick reference guide for primary care providers. I'm hoping everybody has one on their bulletin board or somewhere that they can reach for it if they need it. I'm going to make sure everybody on this call has one. We're going to send out this after we get off the call. And we've tried to condense the AAP recommendations into this very simple, here's the blood level, here's what we recommend. And so we would really like it if everybody had this available. And on the flip side of this would be those questions. So it's very simple, and certainly gives you the resources and know what to do. You don't have to poke around on the internet or whatever. We're hoping this is a good tool for you to use with your clients. So as I stated in the beginning, excuse me, I'm the nurse consultant for the Childhood Lead Poisoning Prevention Program. So just a little bit about the program, that we're housed with the Michigan Department of Health and Human Services in the Environmental Health System Division. So we have a mission to prevent childhood lead poisoning across the state through our surveillance, our outreach, and our health services. And our vision is no child in Michigan suffers from lead poisoning. And we have our work cut out. It's definitely been going it's been going down very significantly. The program started in 1998, and it's significantly, down to 3.6%, when many children back in the late 90s had elevated blood lead levels. And again, our values, the accountability, our accuracy, we want to be competent and effectively communicate. So I invite anybody to call our program if they have any questions. That's our job. We're here for you. And we provide statewide support for primary care providers, local health department, nursing case managers, families, and anybody else that might need our support. And we want to think that we're transparent, and we provide all the information that you would need and want. The Public Health Code has mandated our program, mandated that the state have this program. And again, it established that in 1998, and we have a coordinated and comprehensive plan to prevent childhood lead poisoning. We actually extend grants to 10 prosperity regions throughout the state for education and outreach, and we also provide another 9 grants for prevention activities to the highest 9 areas in the state with the highest percentage of children with elevated blood lead levels. And we also have, again, the educational and outreach program, the technical assistance program, which that's kind of me. It's called technical assistance, so I don't fix your computer, but I'm here to answer any questions about any treatment or resources you may need for your families or your children, and for families themselves, and again, the nursing case managers that may need guidance if they don't often encounter children with high blood lead levels. And we also have a surveillance system, and that requires that all blood lead tests conducted in Michigan be reported to our office. So we receive about 155,000 of those results per year. And we're going to talk about in a minute about what happens to those results and how everybody gets the information and that data. And again, we're required by law to provide an annual report to the legislature, the number of children under 6 that had blood lead tested results of 5 and above. And there's lots and lots of information on our website, michigan.gov/lead, and that is written down for you as we go on. But all that is available there. Information by county, information by zip code. It's all there on our website. And if there's something there that you need and we don't have it on there, you can certainly call us and put in a data request. We'll be happy to help. So the role of our office, again, we receive those daily results. We pull out the high levels of 20 and above, and we get those to the health department immediately. The other results go to the health department on a weekly basis. They receive their reports usually on Fridays of all the children that have blood lead level tests that week that reside in their jurisdiction. But if somebody comes up with a 20 or higher, we get that to them that day that it comes in. There is a law that Public Health Code requires labs to report all the results within 5 business days. If we don't have a result, it's because we never got it, and that can be a problem, and we can track that down. So certainly we've been, the labs have been very good lately, and but we have to prod some of them a little bit to get that in within the 5 business days, but it's certainly working much better than it used to in the past years. I notify the public health nurse at the health department by phone when there is that high level, and we fax that over to them immediately. The nurse consultant, again, right now that's me. I provide guidance and available resources to the public health nurse, the families, and again, our primary care providers. And I talked about they do receive those results for the children on a weekly basis. And then I work hand in hand with our sister program. I mentioned it early, the Lead Safe Home program, to arrange the environmental investigation. That's the first step. And ultimately, the goal is to remediate that home. And we work together again with that program to make that happen. At the health department, again, they receive those blood lead results. They pull those out. They encourage families to get the venous confirmatory draws if they're 5 and above. And they also they have a list of their children that have an EBL, which we consider at 5 micrograms again and above. They contact these families and they let them know they'll be eligible to receive case management services. They arrange home visits. They do a complete child assessment at that visit, care plans, and they provide that education like I talked about, the cleaning, the nutrition, and et cetera. And again, appropriate referrals. Families need referrals to WIC sometimes, Medicaid even early on for developmental assessments. So all that happens at a case management visit. And they're able to, they're not certified investigators, but they can certainly give us a general idea of the condition of the home to see whether it's a concern at that moment. And they always have that in their bag, that Let's Safe Home program application, because that starts the process. The families have to be eligible, it's income eligible for the program to get that remediation dollars. So they assist families filling that application if needed, and we get that process started as soon as possible. The Let's Safe Home program, again, is housed in the Healthy Home section. Again, our sister program we work hand in hand with, and they provide the funds for the abatement of lead hazards in homes for eligible families. They can spend $8,000 to $10,000 or $12,000 in remediating homes. We're talking new windows, new doors, lots of other stuff. So it's a great program, and it's no cost to the family. The first step would be an environmental investigation after the approval of the application, and that is done by a certified lead inspector risk assessor, and these are very in-depth, thorough inspections. They do every surface of the home. This takes maybe 4 to 5 to 6 hours depending on the size of the home. Then that family will get probably an 80-page report on a list of all the hazards, if any, and then the certified lead, they will contact contractors to bid on the job, and then work will happen as soon as possible. Right now we have a shortage of contractors in the state of Michigan, so work is slower than we'd like it to be, but nevertheless they're getting done. And again, we've had a lot more funds available for remediation, so they're doing many more homes than we ever used to be able to. Again, Healthy Home section enforces the landlord penalty law. If a family is renting a home and a child has an elevated blood lead level, that landlord has an obligation of fixing that home or being penalized or even jailed. So they enforce that landlord penalty law, and they also provide the certification of the inspectors and the contractors. Anybody working with lead has to be certified, and that's a role of the Healthy Home section as well. So just a few slides again about the blood lead levels in Michigan. This is 2016 data. This is the last year we have full data for. Our 17 data is coming out very, very shortly. It just has to be approved. We have many laggards. Well, the labs are very good, but there are some. So right now we're still getting 2017 data. So it's kind of a moving numbers, but nevertheless, these numbers are available on our website. But just a few little stats. The number of children tested in 16 was 157,000. And at age 1 and 2, 41% were tested. So again, we're trying to get these testing levels up. We're hoping we're not considered we're all good and everybody's being taken care of. We feel like we're missing a lot, so we're encouraging providers and families to get their children tested. I know it's hard sometimes to get people to stand still for a test, but we're really pushing that to get those testing levels up. So in 2016, there are children under 6 in Michigan with blood lead levels of 5 or above, which are considered elevated, was 5,724. That's 3.6%. And so again, as I stated, the blood lead data is available by zip code, age, or county. It's all on our website, michigan.gov/lead. Our website is being revamped. It should be live in a week or so. We've taken it down and put a new one back up. So check into that in the next week or so and see what you think. Here's just a smattering, just an idea of where the most children with EBLs are. But again, some areas are very, very low in testing rates. So we feel like sometimes that we are missing a lot of children. So we'd like to see that testing rate get closer to that 100% of required testing. And then, getting those children that we consider at risk tested as well. So the number of children, again, it's mostly the lower Michigan, but again, it's scattered around the whole state, and we tend to see the lower testing rates the higher up in Michigan that we go. So I'd like to tell you, and we're really excited that we have a new toolkit. It came out beautifully, we thought. These graphic artists they do a great job, and I'm glad it was them, not me doing this. But I'd like to, inside, it provides a number of handouts, a number of, for pregnant women, you have a handout. For children, you have a handout. For cleaning, you have a handout. It's for any situation. We think we provided that handout for that. And so we are going to make these available to everyone on the call, and we're trying to get these out to as many providers and interested parties as we can. So I'm going to work with Victoria to get your mailing addresses, and we'd like to get these mailed out within the next week. We're going to provide the addresses to our vendor, and they're going to, get them sent out. So hopefully I can get that information from you. And I'd like, if you want to give us some feedback, or if you need anything that's not in the toolkit, we'd love to hear about that. So please let us know. And we're getting to the end here, and this is my contact information, where you can contact me Monday through Friday. I'm here in Lansing. Also our website, and the handouts that are in the toolkit are going to be available on the michigan.gov/lead. And those, can be printed out, as many as you'd like. They look beautiful in color, so if you're able to do it in color, that'd be great. And again, some of the studies, some of the facts that I've used in this PowerPoint have come from the CDC. .gov/lead website, and as well as the EPA.gov/lead website. So I would welcome any questions that we may have. I left a few minutes. I hope I left enough time. I'd love to hear what kind of questions you have.
Okay, thank you. I will take, if you have a question, please feel free to type it into the chat box. And then also as well, I can unmute some of the lines. We do have quite a few people on the phone, so I don't want to unmute every line, but I can unmute just the telephone lines. So if you have a question via the telephone, you can, I will unmute those. So all the telephones are unmuted, but otherwise, please feel free to type it into the chat box. It says, when did mandatory testing for Medicaid children become law?
This is a federal requirement, so I am not sure when, when Medicaid started. I'm not sure, but it has been a requirement at CMS, and so that's something that Michigan is going with as well, to have the same requirement as the federal programs.
And then another question says, where on the website can you find the locations by zip code?
If you go on the website, again, it's in flux at this moment, I think. I mean, please try, but on the left side, go to, I think it'll say resources or data. You want the data section, click on that. And I think the first link, first or second link will say county or zip code information. And it's got tons of that, 1 and 2 year olds, children on Medicaid, children on non-Medicaid, it's got a lot of different information there. So it is right there. And certainly call me if you can't find what you need.
She says she found it. Thanks.
Okay, great.
Are there any other questions or comments for our presenter? And like she said, that if you would like to have a copy of the toolkit, please, you can either indicate that in the comment section on your evaluation, or you can indicate that to me via email with your address, and then we can get you a copy of that toolkit. Or she said that the handouts will be located on the website for you to just print off as well.
Right. We provided the toolkit, again, just to make it convenient to keep those, kind of organized, and depending on the situation, which you should give out at, if this happens, maybe you want to give that handout out. So we kind of did the thinking for you. We want to make it really easy for you. But I think there's only 1 or 2 copies of each handout in those tabs. So if you need additional copies, again, like I said, they are on the web. They will be on the website. They're brand new handouts. And so I think, I'm not sure if they're all there this minute, but they will be within the next week or so. And you should be getting that toolkit, and you'll see what I'm talking about. And certainly print those out at your leisure, and take as many and print as many as you want. Get them out to as many people as you need to.
Since I think we might have one more question. It says, if there is a child whose parent may be bringing home lead dust from a job, what do you, I know what to, is it, if there's a child parent may be bringing home lead dust from a job, I know what to recommend. But if the child lives in an industrialized area where lead dust may be prevalent, are there any suggestions besides moving that may be possible?
Wow, yeah, that's, again, our state has gotten a little bit cleaner with that. We used to have a lot of lead, so all over the country, there used to be lead smelters all over the place, and now I think we have 1 in our state. Again, the cleaning, if there's lead dust accumulating in the home, the cleaning, the wet mopping, the swifter cleaning on a regular basis to keep that lead dust down. The use of a real HEPA vac, the commercial type, it's just not a vacuum that says HEPA filter on it. It has to be an actual HEPA vacuum. It's pretty much the ones the contractors use. And they're quite expensive. I think the cheapest I've seen them are about $200, and they go up to probably $2,000. So those can sometimes be borrowed from the local health departments. Many of them have them to borrow, and I would try to keep that area clean as much as possible. Those are the vacuums that will actually pick up those particles, and because they're so small, they need that special type of vacuum. And also I would make sure that child is not playing in the soil. It could be just settling in that, or provide new sand or something new for that child to play with outside. and maybe have that child tested on a regular basis just to see if he's being affected by that outside environment.
Do we have any other questions or comments? We have another comment. It says, "This was very good. Thank you."
Oh, thank you. Well, I hope you got some more knowledge that you didn't have an hour ago. But again, I'm here to answer any questions. If you'd rather talk to me offline or about a specific problem or question, please feel free to call me. I like to tell everybody, please, that's job security. If I get a lot of fun, but that is part of my job. I hear a lot of comments, oh, I don't want to bother you. Well, that is part of my job. So please call me if you have any questions at all, and be happy to help you out.
I'm just getting more comments that says, "Thank you, very useful information. Thank you," from our team, and they say Iron Country.
Oh, yeah.
In the UP.
Oh, perfect. I saw Ruth was on there, and she was here last week in Lansing with us, so she's probably tired of lead by now.
Do we have any other questions or comments? Okay. If we don't have any other questions or comments, again, just a reminder that if you were participating in a group, please email me a copy of everybody that participated in your group. So first name, last name, and email, so that I can email everybody a copy of the evaluation, and so you're on my final copy of the attendance list. And thank you for joining us, and have a great day.
Thank you.
Thank you, Karen.
You're welcome, Victoria. Thank you for all your help, all your technical help.
Oh, no problem.
Thanks. Bye-bye.
Bye.